Hi, I'm Sahil Sandhu. I'm a junior pursuing a self-designed degree in health innovation,
And I'm Veronica Sotelo Munoz, and I'm pursuing a master's in public policy.
and we're representing the Global Alliance on Disability and Health Innovation Basque Connections team, or GANDHI for short, and also the Helpdesk team. So a big thank you to Jackie Shu, Lillian Blanchard, Dr. Janet Becker, Connor Drake, and our amazing community partner, Lincoln Community Health Center. Meet Maria, a Durham resident. Maria has uncontrolled diabetes and hypertension. But what makes it particularly difficult for her to manage her chronic conditions are a whole slew of social factors. As an immigrant who doesn't speak English, Maria has a hard time navigating the health system. Without a car, she can't consistently get to her doctor's appointments. She can't afford fresh fruits and vegetables. And without stable housing, she has a really hard time taking her medications consistently. And all these factors together create a great deal of stress in Maria's life, which also have negative impacts on her mental and physical health. Unfortunately, Maria's story is not uncommon. Research shows that 70% of health outcomes are determined by social and environmental factors and related health behaviors. But health systems don't have the capacity to manage their patients' unmet social needs. Student volunteers are an untapped resource that health systems can better leverage to improve integrated patient care. In 2018, we received a Basque Connection student follow-on grant to expand our work from Gandhi and create a student volunteer model called a help desk in which students would work directly with patients to connect them to community resources that help address their social needs like food and housing insecurity. This model has been tested across the country and has been proven effective. And in the summer, we did site visits to really understand how do these student help desk models best work and how we can adapt it to the Durham context.
We partnered with Lincoln Community Health Center, a federally qualified health center located here in Durham that services a particularly vulnerable population. Half of Lincoln patients are uninsured. Three-fourths reported having incomes at or below 100% of the federal poverty level. 9 out of 10 are racial or ethnic minorities, and 46% said that they feel more comfortable speaking in a language other than English, mostly Spanish. Lincoln already has a team of case managers that are currently screening patients for unmet social needs and referring them to community resources. We worked with Lincoln to help co-design a help desk model where students follow up with patients on the use of those community resources. Our experiences working with patients have ranged from helping a patient find a service location that is near their home, helping a patient better understand service eligibility criteria. Other times, patients just need a nudge, a simple reminder that they were even referred to a resource in the first place. We hope that these experiences can help patients better understand the use of community resources, address those social barriers and stressors in order to help increase their health outcomes. From a student perspective, students are able to gain a wide range of skills, from a better understanding of social determinants of health, using motivational interviewing skills, and problem solving with real patients on real issues. We hope that these experiences can help students develop their pre-professional competencies in order to prepare them better to be contributing members to our public health system. In spring of this year, we launched the Helpdesk Pilot, where students were able to work with patients to address some of these barriers. 61 patients were screened by case managers, of which 29 were referred to the help desk for follow-up. We were able to reach 26 out of those 29 patients by help desk volunteers. Ultimately, 48% of patients were connected to a community resource.
We're excited to continue our help desk work next year as a new Basque Connections team. We have three primary aims. We'll continue to serve patients as part of our health service delivery. We'll be focusing on quality improvement and evaluation. And we'll finally focus on health policy as North Carolina goes through some massive transformations in its Medicaid program. Ultimately, we hope that our help desk program can help patients like Maria connect to community resources and lead healthier lives. Thank you.